Good day, this is Dr. James. So today what I want to talk to you about is some of the difficulties of diagnosing a person who has back problems. So let me start by giving you just a little idea of what's going on with your spine. When we look at your spine, first of all, we have 7 bones in our neck, 12 in our middle back, and 5 in our low back. And they're labeled C1 down to C7, T1 to T12, and then L1 down to L5. At the very base of our spine sits a triangular bone called the sacrum. The top of it's labeled L1. From C2 down in our spine, all the way down to S1, we all have a disc in our spine separating the vertebra. And the disc really serves several different functions for us. The first is it gives us flexibility, so we're able to bend and move, so our spine isn't just one big solid broomstick. The second thing it does is it gives us shock absorption. And the third thing that disc does is it acts as a spacer because, as you can see here, at each disc level, we have a corresponding pair of nerve roots that leave the spine and they go into our extremities to give very specific function to different muscles, different areas of skin for sensation, as well as different reflexes. So in large part, when you do a proper neurological exam, what you're really looking at is where do you see normal neurological function as opposed to abnormal neurological function. That tells you not only what nerve or nerves may not be functioning, but potentially tracing it back up to what discs or discs might be causing a problem at that level. So here's the structure of our spine. We look at it from the side, same direction, I'm sitting like this. The front of our spine is made up of this big thick bone called the vertebra and the disc. And the back of the spine is made up of these joints back here called facet joints. The job of the front of our spine is to bear and resist our body weight and gravity, while the job of the back of the spine is simply to guide certain kinds of motion and then restrict certain kinds of motion. Now, how most doctors like to evaluate if they consider that there's maybe a disc bulge or a disc herniation is typically as they'll put you into what's called a recumbent MRI, where you lie on your back. Now, what we found here is that the majority of patients, not everybody, but the majority of patients who have pain in their back get relief lying on their back. So it already suggests the very first problem in diagnosing the spine, which is if you're sent for an MRI in a position where you're most comfortable, you may in fact be missing the lesion. You may be in fact missing the problem. So what we do is we send our patients out for what's called a weight-bearing MRI. And a weight-bearing MRI, you have your body weight and gravity pushing down on the spine. Your spine, as I said, is designed to resist that gravitational load on your body weight. So we want to see it in the position in which it was designed to function. In addition, we can bend your spine forward and we can bend your spine back. Now, clinically, that gives us a lot of really terrific information. It can tell us, for instance, whether you have an instability in the spine, whether your vertebra is slipping forward or slipping backward. You may see a slippage where you're lying on your back and see that slippage of vertebra slipping back or slipping forward. Imagine what that would look like with your body weight and gravity pushing down on it. What we see is often tremendous changes from somebody being in a position where they're lying on their back to where they're upright. And in fact, in future videos, I'll actually show you this on MRI. In addition, as I said, sometimes when we bend somebody forward, we bend them back, we see a disc bulge either show up that didn't show up before, or one that was there gets better or gets worse. And clinically, this gives us a ton of valuable information to coordinate with, or what we like to say is triangulate with our neurological examination. So that's the first thing that needs to really occur for most patients who have chronic back pain. And it is unrelenting, or it comes and goes, but nobody's been able to fix it. You've tried chiropractic care, physical therapy, injections, all sorts of things, and nothing seems to work. The first step really is in diagnosing what structure is causing your pain. So briefly, the nerve root itself can cause you pain. The disc can cause you pain. The facet joint can cause you pain. The muscles laying in the back of the spine can cause pain. You can have a slippage forward or backward that can cause pain. You can have a synovial cyst that can cause pain. You could have bone spurs pushing back and that could cause pain. And you could have a confluence of all of those things, a combination of all of those things that will give you pain. And the only way that you're going to get relief is if you take care of and restore function to all of the structures that have lost function. Okay, that's our primer on the spine. We'll see you soon.